Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Everybody so much, and I was in a lot of pain. I have a left knee something, I'm not sure what it is, and that's the only appointment I could get. Physical therapy started, and now I'm like, pain was 10, now pain is 8, so I had to leave at 10 to go for physical therapy. But I missed everybody, and I prayed for all of you, and I love this group. And Dr. Callender, thank you so much. I look forward for this having
What
this group.
are your thoughts about what's going on in India relative to the coronavirus?
Dr. Callender, I got the saddest news on Sunday. Two of my relatives, my first cousins, have died. And I've been crying and crying. We have extended family. We all lived together. It was like 30 children in one house and more than 50, 60 adults like that, great grandparents and everybody. And I don't know how to cope with it. And they have to burn them in the backyard, the dead bodies, nowhere to go. It's a village, you know and even the hospital to go, it's about more than 200 miles. It's in agriculture. And they died on the street, no oxygen, nothing. And they burned them in the backyard. Nobody will take them anywhere. I'm just so down. I'm not happy. The world looks so grim and great to me right now. It just, and we were raised together, and we used to sleep together. All the girls sleep in one room. I wanted to go home, and my uncle said, please come home, but I applied for visa. They said they're not allowing anybody to go to India now. It's dangerous. They said even you will get something, even though I'm vaccinated. So I don't know, Dr. Callender. I need a lot of prayers. I'm just so down right now. I'm very down. I don't know. It's too much for me. Too much.
Well, thanks for sharing with us, because we thought so much about you as we read about the astronomical rate of deaths from coronavirus in India and in Latin America as well.
Thank
So
you,
we're in
doctor.
prayers for you and for India and the rest of the world.
Thank you, doctor.
As we ask for God's mercies, because He alone can help us with this
Yes.
virus.
Thank you, doctor. Thank you.
Okay, John, you want to start off?
Okay.
Well, I thought that was probably okay. Yeah, I think let's go back to the India one, okay?
Okay.
Because I think this is an intellectual issue, but doesn't really. But let's go to India, and then we'll go back to that one.
Okay.
I think that they were talking about they had a new record of 400,000 deaths in one day, and the largest ever in the world. And then close to almost 4,000 deaths on Thursday, which highest number of fatalities in a single day since the start of the pandemic. And the world's second most populous nation is in deep crisis. And the world's most populous nation, I guess, is China. But and they talk about what Chapman was talking about, how they didn't have enough oxygen, they didn't have hospitals, and that they were burning bodies everywhere. We talked about last week as well. And some people talk about why it happened and have all kinds of reasons. They blame the president. They blame everybody. Some say that it's related to the fact that they stopped wearing masks and they stopped paying attention to social distancing and all those other things. But we don't really know. All we know is that the second wave has been devastating. And people all over the world are trying to think of ways to get vaccines to India. And of course, we know, as Chaplain had indicated, deaths are very much underreported because they don't have, as we saw last week, crematoriums are overbooked. So as she mentioned, some people just burn their loved ones in the backyard. So it's mind-boggling. One thing that's good is that people from all over the world are spending time in and addressing the shortages of oxygen and everything else in India. So this is good to see that Russia's Sputnik vaccine has been available to them, and so it's good to see that there's worldwide attention being given to the crisis in India.
What stands out to me is that United States is making 20 million doses of AstraZeneca available, and Sputnik vaccine is 850 million vaccine doses. But, you know, like we're a rich company, we've got more than enough vaccine for our population. But it's like the rich countries have the vaccines while the developing countries don't have the vaccines and didn't get them when the vaccines first became available.
It's all about money, isn't it? Yeah.
Unfortunately.
Rich get rich and the poor get poorer. Sad.
There's another article which like dovetails with this one next. Believe it or not, we're talking about the Sputnik.
Yeah, it's an
vaccine.
interesting article that talks about the second crisis is Latin America, where Brazil, Latin America is the largest nation. They rejected the Sputnik vaccine.
Oh my.
The article talks about why they rejected it. They felt that in spite of what the Russians said, that the data still was a little shaky. Of course, you know, when you're fighting a vaccine, a virus like this one, you wonder about the wisdom of it. But anyway, that was what they decided to do. 14 million confirmed cases and 400,000 deaths. But they decided that when they evaluated, as you keep going down, that they felt that it didn't pass their test, and said it needs more information on the test and the manufacturing processes. And so they do have vaccines, but they didn't have Sputnik, and they turned down the option to receive the vaccine from Russia. Interesting. What do you think about that, folks?
Dr. Callender, I remember when Sputnik first came out, and the Russians did not do the phase 2 testing, so the whole country was the test group. You know.
Yeah, right. Yeah, and that's one of the major obstacles, is that all of the other vaccines have undergone phase 3 testing, but this never did. So that was the reason that they turned it down.
Somebody's got their speaker on.
If somebody has two devices on near each other.
Yeah.
Any
of
other,
me.
any thoughts about that and about the wisdom of that?
Dr. Callender, as the world is going, I lost my family. I'll take anything at this time. Please send it to the people in India, in my village. It doesn't matter. They want any vaccine.
They are. As a matter of fact, they talked about Sputnik was sent to India. Yeah,
Oh, it did? Okay.
yeah, they just sent it to India. India accepted accepted it, but Latin America didn't.
Oh.
Now, this is an interesting article because it talks about the battle that would be going on for patents. And while he may back it, we're talking about intellectual property for the different vaccines. And it's interesting that you may have different thoughts about it. But the question is, what is that going to do to the rest of the world? Will that stop the patent process, stop what's going on? And that's all about intellectual property and money. But what he's suggesting is a waiver of that until the crisis is over.
I had a question, Doc. I thought the companies that develop those vaccines own the patents for them. Like,
well, you have to get a patent. You have to. You can own anything, but until the patent is given, the battle has just begun.
Okay. Yeah. Over at the NIH, they have an institution. One of the institutions deals with that exclusively. You know, copyright, patent law, you know, because all the developments that they come up with, you know, so they have a whole branch over there dealing with.
Right, but they don't give out the patents. They don't give out the patents. Well, they do have a branch. The patent is a different office. There's a patent office that determines that when patents are given, copyrights and those kinds of things, trademarks and all of those things. And so the battle is really just getting ready to begin. And those people who already have patents and those who don't, then there's a battle towards who's the one who legitimately gets the fiscal consequences. Everybody wants to be first, but there usually is only one first. And so the question is who will get the patents. And when you have so many countries working together for a vaccine like this, then the question is, should you suspend all that until after the crisis is over?
So some of the concern in the pharmaceutical industry is that without patent control, you basically hand the recipe over to other countries to set up their labs and manufacturing plants to make the virus. And they say, well, they'll do this without having the safeguards. Just because you have the recipe doesn't mean that you're going to produce an effective, safe vaccine. But, you know, there's, I didn't see anywhere in that article about the pharmaceutical industries setting up different manufacturing plants all over the world. You know, if you look at it just for the good of humanity, that's exactly what would happen. But like we said earlier, it's all about the money.
Yep, that's it. It's going to be interesting to see what happens next. Because they could make us all liars and show us that it's not all about the money. But it's unlikely that that will occur. I thought this was an article that everybody should be aware of. We've talked all about the heart disease and cardiovascular disease being the #1 killer in the world. And the irony of it is that through lifestyle changes, you can reduce the risk and treatment of heart disease. And so this article is all about 6 lifestyle changes that help prevent and treat heart disease. And the first one they talk about is nutrition, and as something we talked about forever. He's highlighting there, vegetables and fruits. And nothing new, same old, same old.
Yeah,
It's just a matter of people. Yeah, go ahead.
shout out to the green leafy vegetables. You know, the old Popeye cartoon about eat your spinach and you'll be.
Oh, yeah.
Yeah. Well, okay, I'm not an advocate of spinach, particularly because it's hybrid. You know, I don't like hybrid. But all of the dark leafy vegetables like greens, kales, you know, I love my greens. We all love our greens. They found that that's just as effective for protein strength building as any meats that you would eat. And so, you know, for the people that like to exercise or, you know, do strength building activities, you can get just as much strength from greens, especially the dark leafy greens. And you could not have meat at all in your diet, but use dark leafy greens for strength building.
How about broccoli?
Good, it's good for you.
They say it's good for you. That's the broccoli and cauliflower industry. But that's a hybrid that's, you know, when your body doesn't like something, it creates flatulence, and broccoli and cauliflower are famous for that. You know, they say you put cheese on it, but cheese is an inflammatory food, so you trade one product for another.
Well, you don't need cheese for broccoli, but
I do.
So you put the cheese on your broccoli, you won't have those broccoli farts, is what they say.
I put cheese on everything.
moderate exercise is interesting because brisk walking, cycling, swimming. Hey, have you been back to swimming again, John?
I have. Yeah, I've been going 3 times a week now.
Oh, okay. All right.
Yeah, I'd rather have 45 minutes. You know, my routine a year ago was 2 hours, but I only get 45 minutes. But I'd much rather have that than nothing.
Yeah, that's great exercise.
For those of you that track your blood pressure levels at home with a monitor, you'll find that exercise has a 24-hour effect on lowering blood pressure. And so if you want your blood pressure low every day, you need at least 30 minutes moderate exercise every day to keep your blood pressure low. You'll find you skip a day of just like not doing anything at all. But that, you know, a 30-minute brisk walk, it doesn't have to be 30 minutes at a time, but just get your 30 minutes in the course of the day, and you can keep your blood pressure. You can regulate it a little better with exercise.
I went to the doctor yesterday, the ophthalmologist, for my glaucoma test, and my blood pressure was 115 over 67.
Good.
Wonderful.
Yeah, that's good.
And this talks,
Go ahead.
this talks about addressing stress, and of course brings in the meditative and spiritual aspects of it. I'm pleased to see that that's in there, because more often than not, they don't talk about the stress reducing capacity of spirituality and meditation, that kind of thing, which is just as important as exercise, but we rarely emphasize. Thinking positively is a good part of meditation, as a matter of fact. And so positive thinking, and remember there was an article about happiness, and positive thinking is one of the keys to happiness. What are some of your thoughts about that, group?
Amen. Amen.
I watch cartoons because I like to laugh.
Laughter is the best medicine.
Yeah, yeah. Being able to laugh at yourself becomes very important as well. And then this talks about something that sometimes we don't mention: evaluating unhealthy habits, substance abuse, alcohol abuse, smoking. All of those things are things we should try to avoid. We talk about the things you can do. These are things you can undo if you can. Not easy to undo them, but if you want to live long, these are some things that we need to do. Then, of course, we've talked about this ad nauseum, and I think most people sleep less than 8 hours a night, except for Chaplain Thorpe, who I think, Chaplain, you're down to 8 hours a night now?
Yeah. Due to pandemic, I used to sleep more than that before.
Yeah, I know. Yeah.
Okay,
But so this is an underappreciated concept of restorative sleep, and how the brain is allowed to remove toxins as a consequence of sleep. And so these are the things that we can do to live as long as we can and have a quality life.
I want to mention another unhealthy habit, and that's for people that have sinus and allergies, taking antihistamines like Sudafed products, because that can raise blood pressure and can, what they call it, arteriosclerotic plaque.
Yep. Yeah.
So Doc, I'm sorry, this is a commercial. I'm inserting a commercial here for AARP. This afternoon at 1 o'clock, they're having an event. It's free, and you can click on it, aarp.org, and it's about the coronavirus, vaccines, variants, and coping. So I think that's kind of right up our alley. That's just that I inserted.
Okay. All right.
If you want to take a screenshot of the connection, well, you can't really see the connection, but if you go to aarp.org, I think it is, you can get to it.
Okay.
Yeah, aarp.org.
Okay. All right.
Okay. And this is another commercial. You know, I'm a blood donor, and I got this commercial the other day saying that we need more African American blood donors, whole blood donors. So why do you think that is?
I think that's nonsense. I think you need more blood donors.
Period.
Yeah.
Well, they're quoting the need for sickle cell research.
I hear that. As a matter of fact, that's one of the reasons why Charlie Drew resigned from the Red Cross, because they tried to say that you need black blood for blacks, which is nonsense. Hey, do you know Rosalie Powell?
No, I don't. I've never met her, but
Yeah.
you know, she's one of the people that's up on the display when you walk in, because she's
Yeah.
100, has 100 donations.
How many have you made?
I got 95.
Yeah, you're on your way, huh?
I'm on my way.
5 more.
5 more. Hang in there.
Yeah.
All right. I'll that's it for the commercials.
Hey,
Well,
well,
that's very good. That's very good, because we need blood. There's no question that we need blood. We need a different component parts of blood as well. Although I'm not a fan of trying to say black blood for blacks, because I don't believe that's appropriate. Nor do I say black kidneys for blacks either. I think we need donors,
How about
whether
that?
they be black or white.
This isn't a racial component, but you know, they say I've read medical articles that said the best blood is young blood.
There's an article on that coming up.
Yeah, we do. We had one.
All right, well then the article will talk about that.
Yeah, it will, because there's a lot of interesting medical talk about that, as you mentioned. Glad you brought that up. But I believe, isn't that one of the articles, John?
Yes.
Yeah, about
gonna
blood.
get to
Yeah,
that.
it may have been yours now. I don't know.
Yes, it was.
Okay, all right. Yeah, now this is an interesting concept that you should guard your COVID-19 vaccination card. And they say that you should take a picture of it and keep it in case you lose the card.
Both sides.
Yes, both sides. So, and it's important to keep it in mind that vaccination card becomes precious in this day and age, especially you want to travel, and they're going to want to see proof that you've been vaccinated. And as you know, there is a scam that people are fake vaccination cards. So, and then that's why there's so much, such as this article on should you get your vaccination card laminated. You certainly should take good care of it. How you do it is another story.
The bottom line, Doc, is that if you get a booster shot, that has to go on the cards. If you laminate it, they can't put that information on your card.
Right. Good point. Dr. George Benjamin. Oh, he leads the APH, huh? Oh, he's done a lot of stuff in his lifetime. He's quite a guy. I didn't know he was the executive director.
He's awfully young. He's only 68.
Yeah. He's done a lot in his lifetime. I think this is a very good article to how we should try to protect it as much as we could.
Yeah, you should put it in a plastic sleeve, but don't laminate it.
Mm.
All righty.
They sell it at Office Depot for $1.49. The sleeve.
Oh, awesome. Thank you, Carol.
Okay. All
Well,
right.
another commercial.
Right. Amazon has everything, doesn't it?
Oh, yeah.
Now, this is for those who lose the card. Wow. That's interesting. I didn't realize that the CDC has a backup, because I think somebody asked that last time in our last meeting. And so the CDC has the information. And I guess so does the District of Columbia, if you're in DC. Yeah. This is an article on those who perhaps should avoid the COVID shot because they try to figure out who are the people who got those clots. And they talk about these conditions, and this at the top, some immune mediated syndromes with cause low platelet counts and thrombosis. Those people who have blood problems should avoid for at least 180 days. What is that? That's 3 months. And they talk about women under 50, only because they have an increased risk of TTS, which is thrombocytopenic syndrome.
What is that, Doc?
Low platelet count. It's a condition in which your platelet count becomes very low. And it occurs not infrequently with some people who get heparin, and then there's that syndrome itself that is standalone that occurs in women, and we don't really know why. And then if you have risk factors for venous stasis, varicose veins, those kind of things.
Dr. Callender, this pertains to the J&J vaccine, right?
Say what?
Yeah. Yes, Johnson & Johnson vaccine. You know, earlier this week, a man got the blood clots from the Johnson & Johnson.
Right, that was the first one, yeah. We talked about that, I think, last week. That was the first man to get it, and I think he recovered, though. Yeah, right.
All righty.
Yeah, this is, it's interesting that whether you're black or white, it is true that they, well, your ethnic background does have some relationship to health. Sometimes they use it inappropriately. And it is clear that there's racism built into most of the algorithms that they use. And so the question is, should it change? And actually the answer is that I think your age, sex, and ethnicity becomes important. Because there's certain diseases that are more common in different ethnic groups. There's certainly certain diseases that occur more commonly in Native Americans, in Japanese, and different Orientals, different ethnic groups. So I think what we have to learn is that we're all similar, but also different. And our ethnicities, and the way we're brought up, the way we're raised, the food we eat, and the cultures we grew up in do make us different while we're the same. You know, diversity begets ingenuity. And I think the reason that we survive is because we are very similar, but still have uniqueness about us. And I think that uniqueness is important to preserve. So the essence is that because you're different doesn't mean that you're superior or inferior. It just means you're different. And I think that's what is important.
My takeaway from this article was was that on the EGFR test, the kidney tests, that they used a race factor of like one and a quarter, which had the effect of lowering the severity for black kidney patients, so that when they were into end-stage kidney failure, that race factor wouldn't trigger there being an end-stage renal failure, so it would result in a delay of treatment. And so, not that there shouldn't be a race factor, but they were saying, you know, like, where's the research to make sure that this is the right race factor, or you know,
well, you know,
it be an arbitrary factor, you know, like make it more scientific.
and the interesting thing about the GFR, which he's talking about, is that the top number is about 100 for most people, and the bottom number is about 20. So it really becomes really insignificant, because when you can have protein in your urine and have a GFR of 100, and protein in the urine is an early sign of kidney disease. And that's when you need to start getting things taken care of, not when you're down at 25. So to me, the issue should be us making the diagnosis when you're at a GFR of around 100 and not worrying about 30 and 20 and 25. But anyway, there's different opinions on everything. So I just think that ethnicity is important. And it can be abused and misused. That's true. But I think there's also a place for it. Recognizing that we are all different and because we're different doesn't mean you're superior or inferior is what. See, they talk about going from stage 3 to stage 4. Well, when you're down that classification, you're already there as far as I'm concerned. So
The other thing that they're saying, if you're part black, you're all black according to these race factors. But, like Colin Powell is a long way away from Denzel Washington. So the question would be, if you're going to use a race factor, how black are you?
yeah. Yeah. Well, now remember, why should you be using it only for one ethnic group? I think you should use it for all ethnic groups.
Yeah.
Neil Poe is, of course, guy's done a lot of research on this area, and I think his opinion is a very good one.
So what you're saying is Black health matters.
Yes.
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 That's catchy. I think I'll use that.
You already used it. It's interesting how all this work on the brain started by this black pathologist, and they fought him tooth and nail, and almost ran him out of Pittsburgh. I think he was in Pittsburgh. They did run him out of there. But he certainly has turned out to demonstrate that this is a disease that isn't about ethnicity. It's about brain damage and being damaged by football and any other thing that would cause brain damage. It's amazing they haven't associated with boxing and those other sports that they beat up the brain.
What was the name of that movie?
Concussion.
That was the name of it?
I'm trying to think. I thought it was.
Yeah, it was about concussion.
Yeah.
I'm sorry.
It's interesting that, we talked, remember, I think John brought up the subject about the fact that race is a social phenomenon and has nothing to do with science. It's something that was brought about because it was created to demonstrate superiority or inferiority of one ethnic group over another. And it really has no place in medicine. And I think the human genome, which proved that in 2003, and the Anthropological Society, which has been talking about that since 1996, have tried to get us to change our thinking on it. But right now, structural racism is present as it always has been. And something that does need to be eradicated, but talking about it doesn't change it. And the place it needs to start is at the White House and the office of OMB office, because that's where the census is made. And while we've talked about it a lot, nothing has changed that. This is a lofty goal, and if you don't have a vision and a dream, you can't make changes. So he's got a vision for vaccinated 7% by July the 4th, which it's a lofty goal.
We're about 30% right now, right?
Yeah, a little above 30%, but we got a long way to go, but no dream, no change.
One of the biggest barriers that I hear to getting everybody to 70% or herd immunity is people saying if you don't get the vaccine, it's your choice. It's okay. No problem. Whatever you're comfortable with. But the other part of the conversation isn't being said. You don't get the vaccine, you're killing me. You're preventing the world
Right.
from back to normal because you're the type of person, your house is on fire, but you're saying don't put water on it because I might drown. Well, you have don't focus on a drop of water getting up your nose. Focus on your house burning down and you get burned up with it.
Good
I
point.
talked with some guys yesterday. One of them was a Republican for sure, and he said that his biggest argument was about that government control. Really, he said the government is mandating me to do something, and I won't do that because I want to be in charge. So no, and I believe that's I understand that and I have a natural reaction to somebody telling me what to do. You know what I'm saying?
Tell them they have a right to be stupid.
Right. But after you learn about it, I'm hoping that, and I think Carol and I had an argument last week. I said, the more you know about this, I didn't mean to imply intelligence or anything like that, but the more you learn about the situation, the better decision you're going to be able to make as far as health and everybody's health, right, Darryl?
Darryl or Carol?
Darryl.
Oh, yeah, right.
You want him to go against his sister?
I always agree with you, John Buchanan, and John Tatum. Anybody that's named John, I agree with.
Okay, so since I'm Carol, whatever. No, Dr. Callender was supposed to get someone on this to tell us why it's in human nature, even though after they accumulated this knowledge, that mankind still has this rebelliousness within them to go against it. Because if this really worked, the more knowledge you have, God gave us knowledge. He even made available wisdom, and it's up to mankind, even after they know it. People know the 10 Commandments, but do they obey them? No, they got the knowledge, but whether or not they do it, that's a whole new different topic. But we're supposed to have an expert to come and tell us why are we that way.
It's interesting that you mentioned that because I was speaking to a psychologist who's going to talk to us about some of those aspects very shortly.
But Dr. Callender, I don't want a psychologist to tell me that. I want somebody that's spirit-filled. I want a godly, God-fearing person to talk on that.
Yeah.
They can help out with that, but I think that's where we're really missing the ball.
Yeah.
That's just me, not because I'm a minister, but I think that if you're going to be a believer in God, you got to have some faith and some trust. As we say, faith over fear, and a lot of folks they don't have that. They don't have that.
I agree with you, Pastor. You're
Thank you.
right. It's our spirituality, and trusting and obeying God, because we know God, Jesus Christ, has given that knowledge to the doctors and scientists, to help us with our health problems and everything. And we must have that faith and trust and go ahead and listen to them, because when something happens to us, when we are dying, who do they take us to? Ghostbusters? They take us to the doctors, and that 7-year-old girl shot in the chest
Yes.
just a few days ago. Where did they take her to? Children's Hospital. They flew her. Today, this morning, I saw her on TV meeting all the people that helped save her. The first responders, the doctors did such a good job. So God puts in our head that he gave this knowledge to our doctors and scientists to do the right thing. And we must have that faith and walk according to it.
Amen.
You know what? My answer to Carol's question, though, is I always go back to Adam and Eve. And if you go back to Adam and Eve and you want to talk about obedience, that's where it all started. Disobedience started right there in the Garden of Eden.
No question about that. This article is about, can air purifiers protect you from COVID? And I think this is often considered because we talk about flying and doing other things, and how important are those air purifiers? And this article talks about it. It talks about the elements that are involved, and it's not just those other things, but it's also the air purifiers.
Well, Dr. Callender, do air purifiers really purify the air? I don't think so.
Well, that's what this article is about. As we'll look at it, you'll see what it's all about. Because the sanitizers are designed to kill bacteria, viruses, and funguses. And the filters are designed to do just that as well. There are all kinds of filters, as you'll see in this article, that trap particles and keep them from, then you have ultraviolet light that kill viruses, bacteria, mold. And you have ionizers that also do the same thing. And then you have ozone generators. And so you've got all of these devices, some of which actually do kill the viruses, the bacteria, and the fungus. And so that's why the article is on air purifiers and the role they play in making things safer. The HEPA filters are probably one of the commonest filters that are used to, along with the UV light. And there are many studies that have demonstrated the UV light kills viruses. But the problem is the ozone has its own problems and its limitations. But the real question that the article is about is it effective against COVID-19? And the answer is yes, up to 99.97%, along with UV light. So that in the airplanes now they have HEPA filters, and they also have it in other areas. Hopefully, if they're opening the theaters, they have it in the theaters. I don't know if they do or not, but and they talk about when you're looking for an air purifier, and the smaller the room, the better it is. The larger the room, the less effective they are. But they talk about things you can do to improve the indoor quality. And remember, we saw that that the indoor is where the problem is. And so that fans help. And the filters, of course, together.
Dr. Callender, what is HEPA?
I forgot what the mnemonic stands for, but it's a filter that actually filters out large particles. And when we talk about viral particles and bacterial particles, but I forgot what the mnemonic. I have to look it up, and maybe somebody will look it up while we're talking and get the answer to what HEPA actually stands for.
All righty.
Okay, it stands for high efficiency particulate air. high efficiency particulate air. It's so a HEPA filter is a type of mechanical air filter. It works by forcing air through a fine mesh that traps harmful particulates, particles such as pollen, pet dander, dust mites, and tobacco smoke.
And they use it in the hospital in rooms to keep the bacteria count and viral count as low as possible. Now, this is an article I hadn't noticed before, that a strong reaction, and I've seen some people have strong reactions to COVID-19 vaccine, and they are suggesting that that implies that you may have had COVID before. And in this article pointed out that those who previously had vaccine had a much more profound response to the vaccine than other people. What does that mean, though? Actually, it just means that the vaccine is even more effective if you've had the virus before, because they mentioned it's 100-fold increase in antibody after the vaccine.
Dr. Callender, is there a stigma of having COVID? Because I've heard some people, they didn't want anyone to know that they had COVID. And I was just wondering, is there a stigma that's going around that I don't know about?
Not as far as I know, but it's all up to us in terms of whether we decide it is. If we personally believe that it's a stigma, then it becomes. But I haven't heard that it is a stigma yet. Time will tell. I don't know the answer to that question. But so far it hasn't been, because so many people have asymptomatic COVID that it shouldn't be, but you never know.
Well, I just said that because I've heard some Christians say they're so blessed because they haven't had COVID, like that was a curse or a sin or something.
Well, it's still a blessing. You don't want to have any infection. So, not surviving it is the curse. But anyway. But it's interesting that where the vaccine has been given, the infection rate and the death rate drops. And this also feeds into the hypothesis of herd immunity. So the more, just like Darryl said, the more people get vaccinated, the more likely we are to have low infection rates of COVID.
Back to Carol's point, I think sometimes people have a tendency to treat other people like they have the cooties. If they have like AIDS or if they have COVID-19, they treat them like they have the cooties. And that means stay away from them. Don't touch them.
Well, they should. If they have COVID infection, they should be quarantined. So that's appropriate. If they have it, if they have the active infection, that's appropriate. But if they have had it, that's another story, because there's no implication that you're transmitting the disease after you recovered.
I think it's a personal thing. I think in my own family, we're somewhat going through that. My grandson, my granddaughter, and their mother have had COVID. One was asymptomatic, my granddaughter, but they say it's hard to plan a celebration for my grandson graduating this year. The public, of course, the world is different. You just don't rent a room and have a party. But even within the family itself, we all have COVID, would they even come near us? Some won't. That's how people think. Got to give it a while. even though it might have been a month. Oh, got to give it a while longer. It's a stigma. I don't know about the cooties thing, but it's a stigma. You know, they're hesitant to be around you. You have it, I don't want to get it.
Carol can tell you about the cooties. Carol, what are the cooties?
John, this is not the time nor place, sweetie.
Well, I'll let Darryl do it then. Darryl, tell me what the cooties are.
Well,
Among North American children, cooties are an imaginary germ with which a socially undesirable person or one of the opposite sex is said to be infected with the cooties. And that's from Google.
well, this is an article about looking to young blood to treat the diseases of aging, and it's interesting that they talk about starting from blood from young mice, giving it to old mice, and they older mice regenerated, and so that's when it all began. And since that time, we've been trying to find the fountain of youth for quite a while. Parabiosis is to take blood and give it to other people, the technique of parabiosis. And so there have been people who have been paid money to get young plasma because they believe that it would make them healthier. And that's a practice that is still exists. And you see this, somebody selling their blood for $8,000 per liter. But anyway, it's interesting.
This parabiosis thing is the history of vampires.
Yeah, that's right. Yeah.
Well, John Buchanan, I hope you make 5 more donations, because after a while, you know, they're not going to want your blood because you old.
Yeah, so we should be encouraging our children and grandchildren to be blood donors because they got the good stuff. They got the young blood.
Right. Right. Yeah.
Dr. Callender, that part of chemistry or biology, I wasn't paying attention. But does your blood last? I thought it regenerated and it sloughed off the old cells and new cells come in. I didn't know we carried the same blood with us from day 1 to day 5 or whatever. Could you explain to me how blood is actually made or produced or what?
It's actually produced from a number of sources. One of the sources is the bones, the bone marrow. The other source is that there's a hormone in the kidney, erythropoietin, that stimulates the bone to produce blood. And in answer to your question, we do know that there's something called the telomere. And as you get older, the telomeres become less capable of regenerating cells. And so as you get older, the ability of the cells to be vital decreases until finally you die. But your expectation is true that for most of your life that your bone marrow is producing blood all the time. The process does slow down as you age.
So all of the cells for old people are not as robust and hardy as young people. We experience things like photocopies. You know, like your first photocopy is the first time your cell replicates, but then like 100 photocopies down the road, the thing is so faded, and your cellular structure, your cellular telomeres and your sheaths get thinner, and so they're not as robust. And so you get that young stuff. It's that young blood. It's all hardy. It's robust. It's got all the good stuff. It's not leaking. It's not leaking your cell products all over your body. And that's the good.
Well, you need a new,
That's a very nice simplistic way of putting it, but
well, you need
it's
a
pretty
new,
good, pretty
you
good.
need a new toner and a new cartridge.
Say again?
You need a new toner and a new cartridge.
Well, you might need a new bone marrow. Because the bone marrow is where the blood comes from. You know, it's interesting in Proverbs, it talks about good for the umbilicus and good for the bone marrow, because the bone marrow is where the restorative processes begin. The bone marrow becomes very critical and important.
Dr. Callender, do you think when they wrote the Bible, they knew that the blood came from bone marrow?
Say again?
Do you think that they knew back then when they wrote the Bible that blood originated in the bone marrow?
Well, when you read the Proverbs and Solomon talks about it, it makes you think Solomon did anyway. When he talks in the Proverbs, he talks about it. So I don't know about they, but I know Solomon in his writings, he emphasizes that. So he talks about the belly button, of course, and we know that the stem cells and all those things come from the belly button. So Solomon knew about it. I don't know about anybody else.
Okay.
Of course, Solomon was the wisest man who ever lived, they say. So
I want to ask a question about the blood, the storing of blood once you give blood. Since you all are talking about the young blood and the older blood, do they keep it separate?
no, you mean, do they keep young blood separate from old blood?
Yes.
Not to my knowledge. The time they take it out and the time they use it, they're able to store it so it's usable. But I don't know that anybody, of course, you never know what they're doing that we don't know. But I don't know that they're differentiating young blood from old blood. John, you know anything about that?
I do not.
Okay. If it's done secretly.
Well, that Young Blood article, I read several of them, and I just submitted the one, but it also talks about positive effects from blood transfusions. Now, you don't know if you're getting old blood or young blood in a blood transfusion, but for a patient that need one, you're getting better blood than what you had. And, anecdotally, blood transplant patients talk about feeling rejuvenated after a blood transfusion. And the other thing it talks about, the effects of that rejuvenation or getting young blood, they can be duplicated, but with exercise. That it has that effect of. So there's certain things that can help increase your cellular strength, and that one of them can be exercise, and the other is the product from wine, resveratrol.
The other thing is when they talk mostly about old or young blood, they're talking about from the time it was taken out to the time it was used. And they often do not refer to the age of the donor in that way. This is an interesting article because the fear of what happened in India, happening in New York, is a concern. Because as we get more liberal, then the likelihood of the coronavirus popping up again becomes an issue, especially if we're not adequately vaccinated. If we're vaccinated, it's not an issue. But if we aren't, then the issue resurfaces. And that's the fear as they liberalize things in all over the country. The one factor that needs to be considered is what percentage of the population is vaccinated in your area. And if you have a very large percentage of vaccination, then it's a much lesser likelihood that you'll have COVID issues. It's interesting to say that nearly more than 147 million people receive one vaccine dose. That's still not good enough. Now, this is an article that is well overdue, but and it's not a very good article in my opinion, but it's one of the first articles around. So, and it does show that there is an impact of COVID on Americans' mental health. What it doesn't do is look at the different ethnic groups and identify how they are responding, because they have small, look, 4 in 10 Americans report they're more anxious, and they're looking to Latino Hispanics more likely to report being more anxious. Actually, there's other data that shows African Americans and Latinos are concerned about their loved ones getting COVID. What this doesn't tell us, which I was more interested in, is what does this do to our young people's mental health? It's a beginning of looking at a serious problem that is going to become epidemic as the days go on, because we have kids who couldn't go to school. We have adults who wouldn't exercise. We have people who are isolated, and as a consequence, people who wouldn't go to a psychiatrist or therapist, or couldn't go to church, didn't go to church. And so a lot of the social things that go along with what we call life have been lost. And how impactful will be the inability to have social gatherings, to go to church, is an issue that remains unanswered, mostly because social isolation is still with us. And as we get away from it, perhaps we'll be able to look and unmask the signs and symptoms of the isolation process that we've had to deal with. And it's interesting to show in this that 31% believe the vaccine is not effective. And how you convince people who have that belief that they're wrong? Now, what it doesn't talk about is data that was actually released from the Johns Hopkins program, which identified that the suicide rates in African Americans were twice as high as those in whites. And why that is impacting the minority, the Latino, Hispanic, and the African American population more than it's affecting the white population. But there is data that makes that. And one of the biggest reasons for them wanting to have school open is mental health, not only for the mental health of the students, but for the parents who want to go back to work and not have to take care of kids. So that this is an issue we've talked about a lot, and the teachers in the group have talked about it as well.
Dr. Callender, may I make a comment on something that you were talking ahead before this? About the mental health issue. Okay. We have Bible study, on the phone, and many of them have the anxiety. Those who are already been vaccinated, they take care of themselves very well. They said they're fearful of these people, those who are skeptical about taking vaccinations. They don't want to go near them, and they want to keep away from them. And in the church, also, when they open up, they don't want to be anywhere near them. They're scared of these people that are not vaccinated, and they're going to keep their masks on, they said.
Good.
Yeah, and that the CDC goes along with them. The question is, when will we ever be able to get back to the normal? And I don't know the answer to that either.
I live with my 25-year-old grandson, and he is reluctant to take the vaccine, I guess, because I don't know, I guess the younger generation, he wonder what's in it and
I know.
what will it do to him and these kinds of things. But we've lived all last year and so far this year, and he hadn't gotten it. We have now been vaccinated, my husband and I. And I mean, we're in the house together, but neither one of us have been impacted by the virus. So those people who are skeptical, I would just say, even though he goes out far more than we do, so far, nothing has happened. So, you know, I guess it's a toss up one way or the other.
Betty, you got your phone on?
Yeah, I'm operating from two what you call them. That's why I'm getting ready to go back to mute. But
Yeah, I was trying to say just turn the volume down.
Thanks for your comment.
my computer went down and I'm operating from a laptop and a phone. So that's why.
Turn one of the volumes down all the way. Not that
Thank you.
one.
Thank you for your comment. I think your being vaccinated protects you to a great extent.
And I'm in the same situation. My son halfway lives here, and he's not vaccinated, doesn't want to get vaccinated. But the flip of the coin, like I said, with my daughter-in-law and the kids, she hasn't been vaccinated. The kids haven't been. They caught COVID. Is that pushing them to go get vaccinated? No. No. What do you do?
Wear your
What do
mask.
you do?
You wear your mask. That's what you do.
Oh, I do. You know, I try to be safe, but
It's just sad that you have to wear your mask in your own home.
I know. It
well, you know, I'm not quite doing that, but I limit them coming in. I haven't seen my grandkids now in about 4 or 5 weeks, which is a long time for me. And when grandmama come see you tomorrow, well, I'll think about it.
Yeah.
We don't wear our mask at home. Never
No.
have. So
No.
Right. Okay. This is interesting conversation, and it leads to a desire for us to get back to normal as soon as we can, for everybody's interest, those who are vaccinated and those who aren't vaccinated. And we wish more people would be willing to be vaccinated, but that's not the case. This is Florida. It's interesting. Florida and Texas have their own way of doing things, and they eliminate all local COVID edicts as of May. So these are people who won't have to worry about being mandated about anything. Let's hope that there's no backfire.
Well, I have a serious problem with this. An individual business still can tell their clients that they have to, you know, have masks on.
Right. Yeah.
But the state or the city or the county or whatever cannot. To me, it's pretty bizarre. But that's that Republican bent I was telling you about. People don't want to be told by the government what to do. I understand that, but you know.
Yeah, this is one of the reasons why Darryl and others have said that democracy has its limitations.
Sad. Very sad.
Well, anyway, it's it's the way it is in America. So we got to deal with. What does this mean?
Wow. Oh, man.
Uh, they fell 4%.
Wow.
Wow. Hmm. Is it related
This
to the?
morning,
And-
Dr. Callender, this morning, my husband said about this. He said, don't worry, we Black people are going to take over. The lady in Mali had 9 babies. Hey, he said, we're going to take over this country.
Well, I'm afraid the United States Census doesn't demonstrate that. We have the census leased to the White House, which demonstrated that 60% of the country is white and 40% is
What?
60% is white and 40% is non-white.
Oh, my
So we
goodness.
got a long way to go.
Oh, my goodness. Mm.
18% is Latino Hispanic, and 14% is African American.
Oh, my gosh.
I think the reason for this statistic is that husband and wives think that they're going to give each other COVID.
May well be. May well be. I don't know the answer, but it's interesting to theorize.
Well,
Yeah.
Did anyone consider that birth control is more predominant, which will stop? Not that people are less intimate, but birth control is more available so people can control how many they have and they don't want any more children. Because there is a sense around people, even when I was growing up, to have a lot of children meant that you were ignorant or poor. And we even talked about welfare babies and everything. The intelligent person's supposed to only have 2.5 children, and that means you're intelligent.
One of the kids ain't intelligent. This is a half a kid, though.
okay, Maya, to your question about when Black people take over,
Yeah.
the birth rate in the United States is slightly under 2. It's about 1.9. And so that means that unless we get immigrants, our population is reducing. And Blacks are in America, our population, to grow a population, you have to be over 2.0. We're not over 2.0 in the United States for the Black population, primarily because of birth control. But the highest birth rate in the world is sub-Saharan Africa. That's Black folks. It's 4.69 children per woman in Black Africa. India is next with over 3 birth rate. China, the Asians are in the 2s, but okay, it's predicted around the year 2050. Should we live that long? I'll be 101, but that's predicted that the highest continent population will be in Black Africa by the year 2050.
Oh, wow. Hey.
It's interesting that the virus cases in LA and San Francisco are plunging, and of course we know what that's done to the businesses in LA with the movie business and baseball and theaters and other things. So since California was the epicenter of the virus, it's been interesting to see how it has impacted the whole country. And California has had it pretty tough.
Dr. Callender, do you think it's too early for all these restrictions being removed?
I think it's a little early. Yes, I do. But I think it's a little early. You know, I would think maybe think about it in June when you have more people vaccinated. But we're doing it now. We just hope we don't have to pay for it. I think as we up the vaccination rate, maybe this will help us. Now, of course, business people are excited about it because they had no jobs. And if they had jobs, nobody was taking advantage of it. What is amazing to me is that in McDonald's and those other places still seem to be thriving.
That's because they had the drive-through.
Yeah, that's right.
Yeah.
Yeah. Mhm. Yeah, it's just about most businesses have the same result. It's a startling situation. They didn't say what pre-existing medical conditions he had, but his interesting. His parents were vaccinated.
Did we look at this last week already?
No,
Okay.
not this one. No. That's interesting. At 11, that's pretty young age too.
Yeah.
Kind of sad that when you have a child that young to die from the virus, it's devastating to lose a child anyway. So.
Oh, that's it.
That's frightening. Last slide, isn't it?
Yes.
Dr. Callender, what age are you, generally speaking, what's the average age when your immune system is the strongest?
Strongest, probably as a teenager. Probably as a teenager. You know, when we look at the transplantation, the people who are more likely to reject are people who are younger, teenagers. People who are more likely to accept organs are older people because their immune system is not as strong. So you'd think people in the teenagers would be the group that had the highest immunity, the ability to fight off.
The other question I had on that same subject, there was a talk at some point that they didn't give young organs to older people, and then they started giving age appropriate donations. You know, if you are 70 years old, you get a 60, a kidney from somebody 60 or so, instead of somebody in their teens. You remember that discussion?
Yes, and there's data that indicates that the younger organs are more likely to cause rejection, and the older organs are less likely to cause rejection. So that appropriate giving an older person an older organ is better for them than giving the older person a younger organ, because the younger organs are more likely to cause rejection than the older organs.
Mm-hmm.
Much of that data is relatively recent. We just recognize that older people are less likely to reject, and their organs are less likely to cause rejection. And younger people are more likely to reject, and their organs are more likely to be associated with rejection.
Mm.
Do patients get blood transfusions during the transplant process, surgery?
Yes, and the blood transfusions cause you to develop antibodies that can cause rejection.
So it may be important to segregate blood by age of the donor so that you're given an age appropriate organ and age appropriate blood during a transplant surgery.
There's no evidence that that is the case, but you have to study it to be able to understand it. And I don't know that any studies like that have to take place.
Everybody, I put the link for the AARP event today in the chat. So if you could just copy it or click on it, and it'll pop up to your to your browser, and then at 1 o'clock you can go on if you're interested in that. They're very, very interesting. You can even call in if you have a question.
Okay, so I see some of you on. Happy Mother's Day to everyone. And doesn't look like it's going to be a lot of sun out on Sunday, is it? But anyway, Mother's Day is the event that used to fill up the church. It was always interesting to me that Father's Day was not the same, but Mother's Day and Easter were the days that the church was packed. What do you guys have against fathers?
I think the rain will be in the evening on
Okay.
Mother's Day. Yeah,
So get out early then, huh?
that's right.
Yeah. Okay, and we'll see some of you at 1 o'clock on Monday. All right.
Right.
Yeah,
And the
that'll
rest,
work.
enjoy Mother's Day and see you next Thursday.
Take care,
Thank you
everybody.
very much for being with us today.
Thank you.